Assalamualaikum and hi everyone. My name is Nur Shafika and my group members are Nurul Alisha Najwa, Putri Anis Atiza, Siti Nur Sravina and Nurhanani Fatiha. We are final semester students of the Diploma in Applied Science from UITM Tapa. Today, we are going to present about safety and health awareness during the COVID-19 pandemic. I hope you guys enjoy it. In this video, we will discuss about what is COVID-19 and how the COVID-19 spread and what is the symptoms. We will also discuss about what is the precautionary measures that have been taken to prevent COVID-19 spread. In this video, we are going to talk about the importance of wearing masks, cleanse your hands regularly, social distancing, and vaccination. COVID-19, or known as coronavirus disease 2019, is defined as illness caused by a novel coronavirus called severe acute respiratory syndrome coronavirus 2 and formerly called as 2019 nCoV. The virus was first identified in December 2019 in Wuhan, China. It was initially reported to the World Health Organization on December 31, 2019. Globally, there have been more than 172.3 million confirmed COVID-19 cases and 3.7 million associated deaths, according to the Johns Hopkins University. Okay, now we are going to discuss about how does COVID-19 spread. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, or breathe. The current evidence suggests that the virus spreads mainly between people who are in close contact with each other and typically within 1 meter. A person can be infected when aerosols or droplets containing the virus are inhaled or comes directly into contact with the eyes, nose, or mouth. The virus also can spread in poorly ventilated and crowded indoor settings where people tend to spend longer periods of time. Symptoms of COVID-19. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate symptoms and recover without hospitalization, and the most common symptoms such as fever, dry cough, and tiredness. For less common symptoms, an infected person may have itch and pain, sore throat, loss of taste or smell. For serious symptoms, an infected person may have difficulty breathing or shortness of breath and chest pain. It takes 5 to 6 days for symptoms to show, and however, it can take up to 14 days.
Assalamualaikum and hi everyone. My name is Nurhanani Fatiha binti Azhar and I will present about face masks. When selecting a mask, there are many choices. Here are some do's and don'ts. Firstly, do choose masks that have 2 or more layers of washable, breathable fabric. Next, it must completely cover your nose and mouth. Make sure the mask fits snugly against the side of your face and don't have gaps. Last but not least, the mask must have a nose wire to prevent air from leaking out of the top of the mask. Do not choose masks that are made of fabric that makes it hard to breathe. For example, vinyl. Make sure the masks do not have exhalation valves or vents which allow virus particles to escape. Do not choose masks that are pelletized for healthcare workers, including N95 respirators. Next slide. According to a review of observational studies, an international research team estimate that surgical and comparable cloth masks are 67% effective in protecting the wearer, while there is no consensus on how long is too long to wear a single mask. 4 to 5 hours are maximum enough to wear a mask. Masks should be worn by people 2 years of age and older. Next, you need to wear masks when you are not around people who do not live with you. Then, anytime you are in public setting or anytime you are traveling, you must wear a mask. Lastly, masks should be worn when you are inside your home if someone you live with is sick with symptoms of COVID-19 or has tested positive for COVID-19. Lastly, in this slide, I will show you how to store and wash a reusable mask. In first step, when you are washing your mask, the ideal temperature is 60 degrees and make sure to use laundry detergent. Next, make sure to air dry it by hanging your mask in direct sunlight to dry completely. Thirdly, take the iron and run over the mask for a few passes to get the heat. Lastly, after ironing, it's better to store the mask into a sealed plastic bag of some description.
Next, I will tell you how to clean our hand. First, use hand sanitizer. Keep bringing and using the hand sanitizer after we touching the surfaces in public facilities, such as when we go out for somewhere like going to the supermarket. The research states that the survival of COVID-19 virus in different surfaces and reported that the virus can remain viable for up to 72 hours on plastic and stainless steel, and up for 4 hours of copper and up to 24 hours on cardboard. Second, wash our hands regularly. Keep washing our hands with soap before eating and after using the toilet. This way can help us kill the germs of COVID-19.
Next, we will talk about social distancing. What is social distancing? Social distancing is staying away between 1.5 to 2 meters from the crowd with the intent of minimizing the transmission of infectious COVID-19. The risks of getting COVID-19 are higher in crowded and ventilated space, where infected people spend long periods of time together in close proximity. This environment are where the virus appears to spread by respiratory droplets or aerosol more efficiently. So, taking precautions is even more important to slow down the spread of coronavirus. Staying active is always important, but at this time, it is best to exercise at home. If you are allowed to exercise outdoors, keep at least 1 meter distance from others and do not use any communal equipment. More importantly, choose to go outside at non-peak time and avoid from choosing busy areas. Select quiet streets or alleyways. Shaking hands and hugging with your friends and family members are common, but now it is time to practice some of these. Keeping social distance cannot be possible at all times. When riding public transportation, look for physical distancing instructions offered by transit authorities. For example, a sign indicating where to sit in a train. Keep a row of seats between yourself and other people and avoid from facing your body towards other people. It's also important to travel during non-peak hours when there are likely to be fewer people. Next, when using an elevator, make sure you stay in opposite corner of the elevators and ensure that your body does not touch the wall too much. Since the travel is for a short distance, doing so won't be too uncomfortable as well. Avoid crowded elevators and follow the instructions such as where you should stand. Here are some tips in practicing social distancing in your daily life. First, avoid from going to any events or crowded place. Do not get too close to people. Try to stay at least 6 feet away. Do not hug, touch, or shake hands. Do not travel long distance. Keep a daily routine like usual, but inside your house. Keep in touch with your family and friends using online platforms such as Facebook. Participate in activities, but remotely, such as virtual workout class. Online buying. Consider to do online buying. Lower the risk of COVID-19 transmission when receiving deliveries with following tips. First, review safety procedures being implemented by the delivery service. Second, wear a mask and keep your distance from the person delivering the item. Third, keep your interaction with the delivery person as brief as possible. And lastly, choose for cashless online payment when the option is available. Next, we will talk about self-quarantine. What is self-quarantine? It is a method of slowing coronavirus spread by staying at home and away from other people. Who need to do self-quarantine? People who have symptoms of COVID-19, close contact to COVID-19 patients, and individuals who travel to other countries in the meantime. Here are some tips during self-quarantine. Firstly, using standard hygiene and washing hands frequently. Second, not sharing things like towels and utensils. Third, not having visitors during quarantine period. And lastly, keep a distance from other people in your household. Here are some do and don't during self-quarantine. What you can and what you cannot. First, you can order in food and have it left at your door. You can video chat or phone call your family and friends. You can try a free workout video on YouTube. You can enjoy reading books. You cannot drive to pick up takeout from a restaurant. You cannot take your pet for a walk. You cannot have visitors over. And you cannot go for a run around the block.
Vaccination. Experts believe that getting a COVID-19 vaccine not only will help keep you from getting seriously ill from COVID-19 infection, but may also protect people around you. Malaysia began its COVID-19 immunization program in February 2021, starting with frontliners as a priority group. Currently, there are 6 vaccines available in Malaysia: AstraZeneca vaccine, Pfizer-BioNTech vaccine, Sinovac vaccine, Sputnik V vaccine, CanSino Biologics vaccine, and COVAX vaccine. Each of these vaccines are produced by different countries and have distinct characteristics in terms of their technology and effectiveness rate. These vaccines may have potential side effects, but in most cases, side effects from COVID-19 vaccines are mild. Severe adverse events such as blood clotting are extremely rare. Everyone is encouraged to get vaccinated. However, for pregnant women, those who are breastfeeding, and people with a severe allergic reaction to any vaccine should only obtain the vaccine after consulting with their health provider. For now, Malaysian citizens can register for a vaccine appointment on the MySejahtera app and wait for their turn to be called.
Conclusion. Firstly, COVID-19 was identified in Wuhan, China in December 2019 and caused by the virus severe acute respiratory syndrome coronavirus 2. An infected person may have fever, difficulty breathing, sore throat, loss of smell, and taste. To prevent the spread of COVID-19 infection, wear a mask, wash your hands regularly, keep social distancing, and take vaccination. Last from us, please take care of yourself, and together we rise up and prevent the spread of COVID-19 in this world. Make sure you have been vaccinated to protect yourself and other community. Thank you for watching our video. Bye!